Hi, in this short video, we're going to talk about the cost of the HHS reporting standards. At the time that I'm filming this video, we're at the front end of the phase 3 distribution. So if you didn't act on these HHS dollars before, or if you accepted the dollars and are waiting to find out those reporting requirements, now's a good time for us to be able to actually make an informed decision. In today's agenda, we're going to be going through and really talking about the key elements of those reporting requirements, how to prepare for the reporting requirements, what are some of the remaining unknowns that we have, and then ultimately posing the question to you as a practice owner, are these funds worth it? So there are at least 2 years of data that you're going to have to provide information for, 2019 to 2020. We know that they want them broken down on a quarterly basis, and we're going to have to report by healthcare related expenses as well as the revenue replacement status. We will also have to provide reporting on demographic information from the practice level, entity information, employee information, patient information. And one of the things that we've seen is if you do not expend these funds by the end of the year, they go into 2021. So there might be 3 years of data that you have to report on, and as is always the case, the devil is in the details. From the reporting requirements we've seen thus far, it's not very explicit how they're going to collect the data, and the reporting application itself is not yet up and running. So we can't see quite yet how we're going to be able to get the data over to HHS. But we do know that we are going to have to report on COVID-related expenses attributed to treating, preparing, and maintaining operations. So we really look at that as any of these dollars that you spend on PPE, air filtration, social distancing, team education. Those specific expenses can only be used, the HHS dollars can only be used net of insurance and amounts received from any other federal, state, or local government that you've received as a practice. We'll also have to report these by 2 categories. The first is general and administrative, and the second is other healthcare related expenses. So on the healthcare related expenses first, because that's going to be the most direct and probably easiest to capture. We want to have related to COVID or caused by COVID, any additional rent or mortgage that you incurred, any additional insurance premiums, personnel expenses, fringe expenses for employees, and or utilities and operations expenses. Again, caused by COVID, so not a great deal of opportunity there to use the funds. But in the other healthcare related expenses, that's ultimately where we've got the supplies, so PPE, hand sanitizer, patient screening, equipment, anything that we did ventilator-wise, or air filtration systems. If you incurred any IT expenses related to COVID, and any facilities expenses. Now keep in mind, these healthcare-related expenses, they have to be directly attributable to COVID. Now, beyond that, once we get past the PPE and direct COVID-related expenses, funds can be used to make up lost revenues. Regardless of if you use the funds to make up lost revenues or not, it appears if we're in for a penny, we're in for a pound, and you're going to have to report on these variables as well. So revenue by source for 2019 and 2020 by quarter. Keep in mind this is revenue, so it's collections, not production. And the way that they've broken out those sources is anything related to Medicare, anything related to Medicaid, insurance, or fee for service. So again, on the production side of things, easy to capture those numbers. If you're not following that through based off of those sources to collections, it might be problematic for you to be able to go back and identify those dollars. We also have to provide that information net of any other assistance that you've received over 2020. What does that other assistance look like? Well, most directly, net of the PPP dollars. Also included in there is any local, state, tribal assistance you might have received, any business insurance claims that might have been paid out. Always, they have their catch-all of any other assistance. And then if you received any dollars from FEMA or the CARES Act related to testing. Now, very unlikely that that's the case for a dental office, but I want to make sure you're aware that that's part of the reporting requirements. In that lost revenue category as well, you have to give calendar year expenses, again, 2019, 2020 by quarter, and you'll have to report on that from that general and administrative, so staff, facilities, promotion, and minor, and health-related expenses. So unlike the earlier part of this presentation, healthcare-related costs directly to COVID-19, this seems to hop into your P&L and ask you to report back on lab and supplies as well. There are other non-financial elements that you're going to have to report on if you accept these funds. And again, this appears to have to be reported quarter by quarter for at least all of 2019 and all of 2020. And they want to know your staffing numbers by labor category. So that means full-time, part-time, contractor, others, identifying rehires and identifying new hires. They also want to know your patient care volume, so total number of patients visited. They also ask for patients admitted and residential patients. So these items that are outside of the dental world, but because this payment is part of the Medicaid and the CHIP distributions, they're going to be asking for it. Hopefully we can just identify that it's not applicable on the dental side and that satisfies it. If not, we're going to need some further guidance in terms of what they're looking for here. We also have to identify some of the elements of our facility. Now they're asking for total beds for medical, for critical care, and then just kind of total beds other. Now, do we have to identify how many operatories we have based off of that information? Again, it's not totally clear. So we know that the benefit is 2% of our prior year's patient revenue. In this phase 3, we might be able to get more than that 2%. Your use of the funds are capped on the healthcare related expenses that we've incurred throughout COVID, as well as that revenue replacement from 2019 to 2020 on a quarter by quarter basis. A lot of the dental practices that we work with had a really strong quarter 1. When we reopened, we had a very strong quarter 3. Some of us are waiting to see what happens in quarter 4, so our use of that revenue replacement might just be to quarter 2. And then we have to think in terms of, did the PPP kind of satisfy that revenue break there? Because we might have a limited use of the funds that we receive, even though we can kind of see what the pot of dollars are. If we're not able to justify them by these reporting standards, we imagine that those dollars are going to have to go back to HHS. That has not yet been identified at the time that I'm recording this video, and hopefully we'll have additional information. The cost, though, right, we had that benefit. This is a cost-benefit analysis, and it needs to be done per practice. We talked previously about the balance billing as it relates to presumptive COVID cases that might introduce a cost into your office. The reporting elements that we just discussed are certainly going to be a cost of your time. If, as I went through those categories, you feel very comfortable and confident that you'll be able to provide that information without a lot of digging through old paperwork, doing additional calculations, really spending a lot of your time trying to justify some of these dollars and how you used them, then that cost or that benefit might be greater than the cost. If you looked at what I just provided and you're kind of anxious about being able to report it, remember, we're kind of metered on how it is we can spend these dollars, and the time that you spend not seeing patients or not spending time with your weekend, the dollars that you spend on your staff to help you prepare for these types of reporting, those are real and tangible costs, and ones that I want you to keep in mind as you think about if these funds are right for you. Another element that I want you to make sure you just have in mind, it's HHS. They're always going to give themselves an out for more data if they think that that's necessary. So the reporting requirements, as we've seen them so far, the first statement on that document says additional reporting may be announced in the future for these payments. We've seen in the reporting requirements that there will be additional details if anybody received $500,000 or more. Also, those who received $10,000 or less from this are somewhat excluded from the guidance that we've received so far, but keep in mind, we've not received any guidance on that $10,000 and under. I don't want to presume that no reporting is going to be necessary if you received under $10,000, but that we want to make sure that we monitor it until we have clarity in terms of what does an individual or a practice that received $10,000 and under actually have to report. So just briefly wanted to bring back up that ongoing billing restriction as it related to presumptive cases. because that is a issue. If you have somebody who entered your practice and there is anything in their medical history that makes you believe that they may have COVID or are presumed to have had COVID, then you have to honor whatever their out-of-pocket would have been. And does that necessarily introduce revenue restrictions on your side? Well, it is going to at least increase the awareness and the testing that you're going to have to do with your patients as they're coming into the door. Is that going to be checking, their temperatures, looking into their medical history? I don't want to take that specific phrase too lightly, but from what we've seen in the reporting requirements thus far, it might not be as problematic as it looks on paper. So that's based off of what we know now. I imagine we're going to receive additional clarity, and I know that we've got through the start of November to be able to apply for these funds. We at least now have the ability to make an informed decision. And so as you think about the cost from the reporting standpoint, as well as where you can use these funds, again, PPE, COVID-related, direct COVID-related expenses, and then making up for lost revenue, after we've included PPP and any other assistance you've received thus far, is what we're able to use these dollars on enough to justify the time that you're going to have to spend when it comes to these reporting standards? Again, very much a practice by practice decision, and I hope that this helps you make an informed decision as you think about applying for and or attesting and starting to utilize these dollars. Thank you very much for your time. Look forward to hearing your questions, and I hope you have a great day.